Hello everyone. In this video, you're going to see a periapical radiograph with a roof fracture and how this area has healed and appears on cone beam CT after 3 years. Let's start out with this periapical radiograph. You're looking at tooth number 30 with a post that's located in the distal root. Upon looking at this very carefully, you should be able to see that there's a radiolucency along the side of the root, which should be consistent with periodontal bone loss. Additionally, if we look at the mesial root of this tooth, you can also see there's a periapical radiolucency involving the apical third of the mesial root. But as you start to pay close attention to the root outline, especially the distal, right about here, you can see that there is a discontinuity in the outline of the root. And if you follow this radiolucent line, you will realize that it goes right to the end of this post. So here is that radiolucency, and this represents the roof fracture. So here we have a roof fracture which have occurred from the apical portion of the post extending down to this portion of the root, and as a result of that we have a separation of the segments, hence the radiolucency, and presumably as a result of that you have periodontal bone loss along the side of the root. So this radiograph was taken in 2015, and this tooth was actually extracted in the summer of 2016, so 3 years ago. So now we're going to fast forward to present day and going to take a look at how this side appears after 3 years of healing. Keep in mind that this patient is 87-year-old male, and let's see how this area looks. I have already oriented my cone beam CT scan so that you're able to see the corrected sagittal view of the area. One thing that I want to tell you is that here's the area of interest, site number 30, but just the way I have oriented, it looks as if you're looking at the site of number 19. I just want to confirm one more time from this view that indeed you're looking at the patient's right dentition. So here's the side of number 30. Again, we can confirm from the axial view. We're seeing the cross-sectional image of the premolar, and there's the area of missing tooth number 30. So now, as I scroll through this volume, what you will realize is that you can still see the outline of the original socket, but the alveolar crest has been fully healed and established. And while this is still radiolucent, you can vaguely see some type of calcified woven bone or loosely arranged trabecular bone, and you can see here as well. So something that you can learn from this case is that even after 3 years, and while it's fully healed and the alveolar crest is intact, the trabecular bone of the extraction socket may never be exactly identical to the surrounding structure. And this could be due to patient's age and ability to remodel the bone, which is what exactly happened in this case. It just doesn't have the same radiographic density as the surrounding trabecular bone. And as we see that in this cross-sectional view, again, if I go slightly distal to that, you're seeing a lot more normal trabecular architecture in the pattern. Whereas if I go to this area of extraction, yes, it is healed. The buccal and lingual cortical plates are intact. The alveolar crest is intact, but it does not have the same amount of bone density. It can, so I just want you to be aware that while it may appear worrisome or largely radiolucent, this is perfectly healed and remodeled edentulous area. So let's examine the mesial socket as well. So again, look at the cross-sectional view. We have more bony density in the perhaps inferior 2/3 of the extraction socket, but in the cervical third, it's quite radiolucent, right? So I expect this is a you're looking at a large marrow space. Yeah, so that's what I wanted to show you. And I don't always get to show you roof fracture from a post, but I think it's really cool that you got to be able to see this radiograph. So thank you again for your attention, and I will see you in the next video, and be sure to subscribe and continue to watch my video throughout the semester. And I'll see you next time. Take care.